may be experiencing dizziness, lasting headaches, or some degree of confusion. 1 in 4 of you may be experiencing symptoms of a mild traumatic brain injury known as a concussion. Sport-related concussions are a public concern with over 1.5 million reported annually in the US. It's thought that this is only 1/2 of all that actually occur. Taking this from the athlete's perspective, who just wants to play their sport, if they feel abnormal at all after an injury or an impact, they are not likely to report it. Because of this, symptoms are likely to linger after injury, and a concussion is likely to remain undiagnosed. Current tests utilized on the field are unable to readily identify a concussion. Reliance on self-reports of symptoms is not ideal, as the athlete is often able to perform well enough after an injury or just bad enough at preseason testing to be deemed safe to play. This is where our study on pupillometry, the measure of pupil size and reactivity to light, come into play. Utilizing a pupillometer, a handheld device that computes 8 different measures of eye reactivity and motion in seconds, can offer an easy-to-use, non-invasive, objective measure to identify concussions. A pupillometer can be used during preseason testing and again used on the field or on the court at the time of a suspected concussion. We conducted a pre-test, post-test study on NAU women's soccer athletes during the fall 2019 season. Baseline testing was completed and the athletes were followed throughout the season and were retested again if they sustained a concussion. The aim of this study was to assess eye movement and reactivity to identify an objective measure that would decrease the need to rely on subjective, self-reported symptoms like dizziness, headache, and confusion. During the study, an important finding was discovered. 4 of the 28 athletes I tested with the pupillometer had abnormal measures. This indicated eye function similar to those who would have sustained a concussion, but these 4 athletes had no diagnosed concussion and they reported no symptoms. Previous studies have demonstrated the same abnormal eye measures on patients in the hospital in the intensive care unit with a traumatic brain injury. The goal of this study is not to stop engaging in sport. The goal is to make the athlete safe in sport. I believe there is a need for a long-term study following athletes across a variety of sports to confirm the reliability of pupillometer utilization as a primary method in immediate concussion identification. Quick identification is important to end the preventable and permanent, life-altering, and at times life-ending impact that this injury can have on an athlete.